Sexual health is a topic that has been stigmatized throughout generations, especially in regards to the LGBTQ community. Through conducting a population needs assessment, our group determined that there was a need for further education in regards to the sexual health and wellness of the transgender community. The group that we have decided to target is all college students at the University of Arkansas in order to educate those a part of this community along with introducing the importance of this topic to those who are not. By educating all students, we hope to break any stigmatisms that currently exist and provide necessary information to anyone who may be in need of it. In regards to the Erikson theory of psychosocial development, this topic falls under intimacy versus isolation. There is an awareness that sex education for the transgender community is not communicated. In fact, many in this community get information from peers, creating a strain of misinformation. This leaves room for dangerous sexual practices that can lead to the spread of diseases or other unsafe experiences. College students' previous exposure to sexual education in the United States public school system has been shown to be narrow-minded in its approach and inapplicable to students of non-cisgender norms, leaving gaps in education for these communities. We want to fill in these gaps through providing community and education to anyone on campus who may be interested. Look to Healthy People 2030 when considering the populations that need to be educated. We chose to communicate this information to all students instead of to those who identify as a part of the transgender community because one goal of Healthy People 2030 is to reduce the bullying of transgender students. By raising awareness and facilitating a community where this population feels supported and accepted, we hope to achieve this. Our main goal of promoting sexual wellness to transgender community will hopefully contribute to another goal of Healthy People 2030, which is to reduce the number of new HIV infections. Through educating at-risk communities on safe sexual practices, this can be achieved. The project is an example of a primary prevention method in the level of prevention model displayed. By educating students on ways to prevent sexually transmitted diseases along with other safe sexual practices, we can prevent the transmission of deadly diseases such as HIV. We also seek to educate on secondary prevention methods such as getting tested for STDs between sexual partners at places such as the Pat Walker Health Center. Along with that, we need to educate some students on tertiary prevention methods, such as the importance of getting prescribed antiretrovirals to prevent the progression of HIV in the case that the student has already been exposed. The main goal of our project is to make college students at the University of Arkansas more aware of the importance of transgender sexual wellness. The first objective is that by May 2024, a table at the University of Arkansas Union will be rented out to pass out pamphlets on transgender sexual education to at least 200 college students that day. Our first strategy is to put in a request with the union in order to pass out these pamphlets, and our second strategy is to create a pamphlet with easily comprehensible information regarding transgender safe sex practices. The call to action that aligns with this objectives is that students will take the pamphlets. Our evaluation on this call to action is that the pamphlets will be counted by the end of the day to see if 200 were distributed. Our second objective is that by December of 2024, 20 new members will be added to the University of Arkansas Sexual Health Organization and Outreach Club. The strategy for this is that we will create a social media account to advertise information regarding transgender sexual wellness. The call to action that aligns with this objective is that students join our club. Our evaluation will be that 20 new members will have joined the club by December of 2024. Our final objective is that by August of 2026, a transgender sexual education course will be available to enroll in at the University of Arkansas. Our strategy is to reach out to the Chair of Gender Studies at the University of Arkansas in regards to the creation of this course, and the second strategy will be that learning outcomes will be developed in regards to this course. The call to action that aligns with this objective is that students will enroll in the class, and our evaluation of that goal will be that 20 students will enroll in the course by the fall of 2026. Hopefully, by the time that all of these objectives have been completed, our main goal of educating students at the University of Arkansas on transgender sexual wellness will have been achieved.